Let's take some calls. Carol, Washington, D.C., the great WMAL. How are you?
I'm fine. I'm calling because I'm a former Democrat.
Yeah.
And I'm a member of the African American community.
Mm-hmm.
And you know what? I realized with President Obama, we voted for him twice. And I'm so sorry we did. I'm realizing he has lied, particularly about health care. He has lied. My parents have Medicare and Federal Blue Cross Blue Shield. My dad worked 50 or more years. He was a volunteer. He was a soldier. And this, what Obama did, what Sarah Palin said was true about them warehousing elderly people and forcing them to die. My father was at George Washington University Hospital. They ignored his medical advance directives, saying that he wants to live, keep him alive, do whatever you need to do at any cost. He mentioned his religious beliefs. And you know what? They did not. They refused to give him a feeding tube. They took it to court, got emergency temporary guardianship. My father's been married over 60 years, and my mother and I have no say, and my name was on as power of attorney. They fought so hard because I was told they didn't want to waste money, and now my father's being starved to death.
Is this related to Obamacare?
Yes, because I have been told, my sister got involved.
Because as a general rule, they want to push these people out of the door, don't they?
And that's what they're doing. What Sarah Palin said was true. See, I was brainwashed to automatically discount what any Republican would say. And then when my family and I started to be impacted, listen, my father has Medicare, Federal Blue Cross Blue Shield. They started to be impacted because the primary care doctor they had for 7 years no longer accepts Medicare and no longer accepts Federal Blue Cross Blue Shield. Now my father and mother have to pay $300 and $400 out of pocket in order to see her.
Each visit.
And what's happening now? My father, GW Hospital, went to court. They fighting to kill him. They forced him into a nursing home, a godforsaken nursing home, in a neighborhood in D.C. that I didn't even know how to get to, that I only heard about on the news when they have shootings in the day, and he's over there. And there's nothing we can do. His doctors at Johns Hopkins wanted him transferred over.
All right, wait, I got it. I got it. And your premise here is that this is only happening. He had the care he needed. He had the medical coverage he needed. And then comes Obama and Obamacare, and the bottom dropped out. Is that right?
I do research, and I'm finding out, and I'm talking to people, and this is happening a lot. And I'm realizing he wants to get rid of the elderly people. My father's 93.
Oh.
He's an American. He fought for this country.
93.
And you know what? They want to get him off of the Social Security so they don't have to pay for that. Yet President Obama, Mr. Obama, here he is giving money to illegal immigrants, giving them Medicaid, paying for their food, housing these people, I guess so they can go and work these low-wage jobs. I don't understand this.
All right, Carol, I can hear your suffering, and I'm very, very sorry. And I'm very, very sorry for your father. I really am. God bless you and your family. Yeah, I have a 91-year-old father. I worry about these things. We all should. Because we are turning into Europe. And in Europe, they look at somebody's age. Now, I don't know what's going on at GW, so I can't speak to that. But I'm talking about as a general matter. In Europe, they, quote-unquote, cut their losses. If somebody's particularly ill and it's going to cost a lot of money, out the door. If somebody's particularly old, over 75 years old, I take it, out the door. If somebody keeps coming back, well, they can't keep coming back. And so decisions are made that cost people their lives. They cost people their lives. And you can remember Obama kind of talking about this. Well, what are you going to do? What are you going to do? Remember Rahm Emanuel's brother. What was his name? Ezekiel. Evil. Yeah, they treat lives like statistics. No question about it. That's Obamacare. All right, we'll be right back.